Precautions after the session. The therapist should tell his or her patients not to stop visiting their doctor regularly by the fact of undergoing biomagnetic pair treatment. It is the patient's physician who is required to diagnose the disease and to monitor its clinical course. The patient is the doctor's patient and not the therapist's patient. The therapist only helps the patient to heal. The patient should be advised to tell his doctor that he is also following natural treatments for his disease. However, this decision of telling or not his doctor should be left to the patient, who knows his doctor's human and professional qualities and knows what the reaction will be. This decision will also depend on the laws of each country. Some countries are more open to natural medicine, while others are more closed and subject to heavy lobbying pressure. In any case, the physician is the person who has to monitor the progress of the patient's illness. By monitoring it closely, he can constantly adjust the intensity that the medical treatment requires at any time. Biomagnetism sessions often lead to such an improvement of the condition that the patient will often require lower and lower doses of drugs, or even that drugs will not be needed anymore at all. The therapist must seriously warn the patient of this possible over-medication. The patient should be aware of getting the correct dose of drugs each day, especially in diseases like diabetes, AIDS, or other chronic or degenerative diseases. But it is the patient's regular physician and not the patient who must monitor and adjust this dose at all times. And the therapist should intervene in this decision even less if he or she is not a licensed physician. When a patient with a supposedly incurable disease undergoes biomagnetic pair treatment and gets cured, the therapist should advise his patient to take back the tests that diagnosed his illness, but possibly in another hospital or another medical facility where the patient's previous clinical history and diagnosis are unknown. The patient will then be free from that stigma. Finally, the therapist must warn his patient that the ultimate responsibility for health is not the therapist's, but the patient's. Not even magnets cure, they only balance the pH. It is the patient's body that heals itself. The patient and he alone must therefore actively pursue a healthy diet, a life free of bad or toxic habits, and have a relaxed mind, free from destructive emotional conflicts.